To provide an overview of the presentation about chemo-free in follicular lymphoma, we have to consider that in present days, chemotherapy has some limitations, including the fact that it's not curative and that it results in several short and long-term toxicity. New agents have been developed, such as monoclonal antibodies, immune modulators, or kinase inhibitors, who today can play a new role in managing patients with follicular lymphoma along their journey. So I think it's a way to go in follicular lymphoma to develop chemo-free approaches. First, because we are not curative with chemo. Secondly, because the more we understand about follicular lymphoma, the more we know that the microenvironment play a role and that the immune control of this disease is important. So working with agents that will be able to modify this microenvironment will probably be successful in managing this patient. For instance, we have learned that monoclonal antibodies such as anti-CD20 already limit the growth of these tumors and are able, either alone or combined with chemotherapy, to improve survival of patients. So today what we aim to do is to develop further combination with anti-CD20 antibodies, putting aside chemotherapy and combining them either with other antibodies or potentially with immune modulators. One of the arguments to combine anti-CD20 with other agents comes from experimental data. For instance, it has been shown that T cells present in the tumor are unable to fight against tumor cells. So if we are able to revert this inhibition of T cell function by adding either antibodies that block the so-called immune checkpoints or immunomodulators such as IMiDs, for instance, this may increase the activity of anti-CD20 antibodies. And this concept has been developed in the clinics, and there are some encouraging results of the combination of lenalidomide plus Rituximab, lenalidomide plus Inotuzumab, or anti-PD-1 antibodies plus Rituximab. And I think we have to move further on with these kind of approaches.